Endoscopic closure of a gastrocutaneous fistula with an over-the-scope clip. An 80-year-old male presented with 4 months of persistent leakage of gastric contents through a gastrocutaneous fistula at the site of a prior gastrostomy tube. The gastrostomy tube was placed during an upper endoscopy 14 months prior to this presentation for dysphagia from advanced lung cancer resulting in mediastinal adenopathy. His dysphagia resolved with radiation treatment and the gastrostomy tube was subsequently removed. An upper endoscopy was performed for closure of the fistula. During upper endoscopy, the fistula opening was visualized at the site of previous gastrostomy tube along the anterior gastric wall. Here we see finger palpation at the fistula opening over the anterior abdominal wall. Patency of the fistula was confirmed by irrigating water through the fistula from the gastric side, causing it to leak from the opening over the skin. Argon plasma coagulation was applied to deepithelialize the fistula opening. The scope was removed and fitted with a traumatic type over the scope clip. The scope and the clip was reinserted and advanced to the mid-gastric body. Twin graspers were used to grasp both sides of the fistula opening. The tissue surrounding the opening was retracted into the applicator cap. Under continuous suction, the clip was deployed. Inspection of the clip showed it in proper position, closing the fistula opening. Water irrigation over the clip did not leak through the skin, confirming closure. At the conclusion of the procedure, a total of 4 cc of fibrin glue was injected into the fistula tract from the skin side. There were no immediate post-procedure complications and the patient was discharged home. At 4 weeks follow-up, the patient denied further drainage. The fistula opening was no longer visible on physical exam, confirming successful closure. Gastrocutaneous fistula following gastrostomy tube removal is a well-recognized complication following long-term gastrostomy tube placement. Over-the-scope clips are a safe and effective closure method and can often avoid the need for more invasive surgical closure of persistent gastrocutaneous fistulas following gastrostomy tube removal.